All right, listeners, welcome back. Today is a real spicy one. I'm talking like five jalapeno level spicy, and it is about jaw surgery and if it's helpful at all for your TMJ pain. And why is it that your insurance companies will actually pay for jaw surgery but not orthotic treatment? So listen up because we're going to open up. Mac, I've got a
Yes,
provocative truth to share with you.
give it to me.
And it baffles me. One of the most confusing things, and honestly, it's just disturbing. In TMJ care, insurance will often pay for irreversible jaw surgery, but not for conservative orthotic treatment that could prevent surgery altogether. Why do you think that is?
It is a horrible situation. Let me just first say that because surgery is last. Why insurance companies do not pay for prevention or palliative treatment or anything that has to do with TMD, TMJ is such a disservice to people who pay money to have insurance, thinking that they're going to be covered, and they're not covered in any fashion or form. I do not understand anything about that, why that happens, how that happens, but I can tell you this. No insurance company has ever called me and asked me my opinion on what it should be. They're
Mm.
sitting in their little towers and they're coming up with these issues. They're getting advice from surgeons. And if you're a surgeon, guess what? That's all you know how to do. If you're a surgeon, you don't know how to prevent things, you just know how to fix things. And unfortunately, when it comes to TMJ, you can't fix things with the surgeries that they do. There are surgeries, and I'm going to let you explain that because you know more about it than I do. There are surgeries that can help, but going in there and messing with that joint complex, they're doing the wrong thing and they're getting paid for it. And then the patient is in total misery for the rest of their life in most instances.
Yeah. So, to our listeners, with TMD, there are different surgical procedures you can have done and typically done by an oral maxillofacial surgeon. One procedure, I'm going to go from simplest to probably the worst or most complicated. And Mac, chime in anytime you want. If I forget something, please. The first one is something called arthroscopy. And that's usually in their office, not a big deal, where they go and flush out the joint. They could use different medications to do it, steroids. They can use anesthetic to decrease pain. They can also put some fluid in there to help the lubricant for joint function. And that can be helpful for a short-term period because it takes away the pain, the inflammation. Um, and but it's not correcting the true issues. I'll get into that in just a little bit. The second option, surgical option, is where they actually take that ball, the condylar head of the mandible. Remember, every joint's a ball in a socket, right? And they will actually remodel it or even do a total joint replacement. I don't know very many surgeons that even will do that because that's at least $100,000 procedure that is most of in literature 50% of the time effective. I would say it's even less than that. It's probably 10% of the time, and no one's tracking if it has to be redone, how successful those redo
Right.
procedures are. Um, that does affect your function for the rest of your life as well. The third type of surgery that is done to help with TMJ pain is a mandibular and maxillary advancement, which is MMA, that's the acronym, where they break the mid face depending on the positions. They can break it in different places. And then they also break the mandible on both sides and advance both of them forward. Um, that is about a $250,000 procedure that insurances will cover, but is completely ineffective for TMJ. pain. It is very, can be very effective for sleep apnea, but that's not what we're talking about right now. So, jaw surgery is irreversible. It alters the anatomy permanently. There's a high failure and complication rate. It's expensive. It doesn't address the airway, muscle, neurological drivers, but it's covered because it's, quote, medical. And yet, our neuromuscular orthotics is non-invasive, it's reversible and diagnostic. It addresses muscles, joints, bite, and airway. It often avoids surgery, and sadly, it's not covered because it's labeled dental. So the system will pay to cut, but not to correct. And that just pisses me off. They will not cover you, my dear patients. They will not cover a five or $8,000 orthotic, but they'll cover you to cut you and have you do a procedure that's life-altering and seldomly successful. Explain that to me. And please talk to your insurance companies about this.
And your orthotics that you're talking about are so precise that lining up the jaw, the lower jaw and the upper jaw, to where the joints are not compressed, the airways not compressed. How much tolerance do you have, Pam, millimeter wise? And a millimeter is very tiny.
Mhm.
What can a tenth of a millimeter, a hundredth of a millimeter, a half of a millimeter do when you're trying to find? This has two phases to it. One is the bite, and the other is jaw to jaw position. How close do you have to be to get the sweet spot when you are moving the jaw forward to find a location or a spot for the orthotic to be comfortable? It's minimum,
It has to be very precise and
very precise. So
very.
when you lay open a person's face, I'm gonna be real frank here,
Mhm.
when you cut the upper jaw into pieces and you cut the lower jaw into pieces, how can you be accurate enough to put things in the right place? And once you do it, it's done. With the orthotic, oh, that didn't feel, patient says, that doesn't really feel that comfortable. Oh, well, let me remake one. Let me adjust it. They're removable, they're adjustable, they can be thrown away. You can make a new one. But when you cut and break bones, and that's what you're doing,
Right.
it just doesn't make any sense. And I can't even begin to answer you about the insurance paying for something, a $250,000 surgery, except somebody's got more power than you and I do.
Insurances are run by attorneys and financial people, and they do everything based to codes and not outcomes, which is crazy because it can ultimately cost them more money. It doesn't make even any business sense. But surgery fits the medical billing model, and orthotics fall into that gray zone between medicine and dentistry. So there's that confusion, and like, thereby making our preventative care notoriously like misunderstood, and patients come back confused. And I get this all the time. Well, why will my insurance company pay for jaw surgery, but they won't cover your orthotics? I mean, I don't have an answer for that. Coverage does not equal correctness, you know? It is it upsets me, it frustrates me for my patients and for those of you listeners. uh, Insurance companies will change. It takes time, but the drive has to be from the people who are paying them, which is you and me when I'm a patient. And if we demand that, hey, why is this not being covered? It saves their company money. It does all the other things I already discussed. If enough people keep shaking the cages, well, we'll get a door to open somewhere. It just takes time. And, I'm asking all of our listeners and viewers who are suffering, get all over your insurance company, make
100%.
them listen.
The insurance companies, to the listeners and viewers of this podcast, the insurance companies are going to pay zero attention to the dentist and or the dental profession. Zero. They are your client. They're dealing with you. You're their clients, and they have to take care of you. you have to demand, and everybody has to demand that there needs to be better insurance coverage. And besides dentistry, you have dental insurance and you have medical insurance. They're not anything alike. Dental insurance is no such thing. It's a benefit. It's alive from the very beginning, and it's not a good deal. Dental insurance is never a good deal for the person who's buying it or the company's buying it for them, period.
You know, again, our listeners, as you're thinking through this, we're not trying to, yeah, I guess we are trying to get you guys fired up so you
Absolutely.
get all over your freaking insurance companies. Because what I just don't understand, like in the field of medicine, surgery is usually the last step, but in TMJ care, their insurance has flipped that order. Why the heck is that? Say that to them. You know, rattle those cages. Let's get this taken care of. I'm going to still charge what I charge. I'd rather be able to treat more people, and other dentists want to do this. So it's not so complicated. And we're not going to do that unless patients have a more affordable way of getting care.
And it's not the dentist's decision whether they take your insurance or not. It's the fact that insurance does not pay for any TMD or any TMJ conservative treatment, period.
Right. So you think we fired everybody up?
I hope so. I'd like to see them raising all kinds of hell because dentistry is driven by the public. It's not driven by us dentists who sit all alone in their little office and minding their own business. We have no power whatsoever except what walks through our door. And then sometimes that's not taken care of good as it should be, which I'll agree with people who have had bad dental experiences. That just really upsets me also.
Yeah. Well, we're doing our best to open up and create awareness. So
Yes. So sign up, support us, share this,
ask
and let's get
questions.
something going.
Tell us if there's something you want us to touch on. We'd love to hear from you.
Absolutely.